How can you prevent it? Be more honest, more open. When you hit a rough patch, and we all hit rough patches regularly in medicine, particularly taking care of very sick and suffering people, is to talk to somebody. Very important. If you keep it all inside, let it bottle up, what'll happen one day is it'll explode and you'll be in big trouble. Please don't let that happen to you. Okay? Very, very important. Talk about these issues that create trouble for us. Okay? Sometimes this means sometimes it means it's identifying, we may or may not be aware, identifying the patient. Thank you very much. Miklos, my savior, Professor Miklos, my savior. Thank you very much. You may or may not be aware of identifying the patient with someone you love. Happens a lot. A little bit older man comes in to see us for chest pain. We're not aware of it, but we start getting frightened. And the heart starts going, we don't feel well. Oh, what's going on? I don't know. There's this older man coming in with chest pain. Maybe we're aware, maybe we're not, about our father at age 55 who dropped dead of a heart attack. We may be aware of it, we may not. So when these things happen, to be able to talk to our friends, our close confidants we can trust, it's very, very important. Okay? Not to leave it bottled up. These things will happen again and again and again. I saw one of the psychiatry, I believe maybe fellows or residents or in psychiatry, I saw a little picture of her who was part of the humanities program talking about experiencing hell and advising to go through it. And I heard that she was in the emergency room, the emergency faculty, when a young woman, I believe it was an accident, a tree fell on her and had terrible, wounds and disfigurement. Turned out to be her sister. And she talked about that experience and then how to continue to work with that and deal with it to be able to get through it healthily. Healthy. Very, very important. Okay. I think what I'm going to do, I don't know, you guys going to be interactive or not? I don't know. I'm going to leave a little time for interaction. What you can do, which is very fair, and I do this in a lot of Asian countries when people are a little bit shy to talk, you can write something, a comment or a question, and then we'll do it anonymously, just pass it down. So please feel free to do that if you'd like. Anyone maybe has a question verbally or a comment? Don't worry about feeling stupid. Oh, my classmates are going to think I'm stupid. Don't worry about that at all. We're not judging anybody here. Remember, this is self-assessment, okay? We have a brave soul that's going to break the ice. Wonderful. Please. Yes. Lovely. Thank you very much. Could you all hear the question? It was about medicine Buddha, and in Buddhist countries, the doctors are practicing different than in non-Buddhist countries. And I think the answer to at least the part of the question about practices, I think yes, there is a difference. I do see a difference. I think that the people that I meet who are medical students, nursing, dental students, in Buddhist countries like Mongolia, some federations in Russia, that they have a spirituality that they bring, just as people, not everyone, but many of them, that they bring with them as a doctor. So they put on the white coat, but at the same time, they're putting on the coat of, you might say, purity or spirituality. Not that they are, pushing anything on anybody. I don't see that. They're not kind of, pushing religion or Buddhism on people. No. But what they're bringing is a heart, an open heart that maybe they've cultivated through their Buddhist practice. And I don't think this is unique to Buddhism. I see Christian doctors and nurses with tremendous open hearts, very kind and giving and wonderful people. I'm sure the same is true in the Islamic world, and I'm sure the same is true in the Confucian world and other religions. Of course, I see it a lot in India with people that are of the Hindu faith. Of course, some people go to the extreme of pushing their religion, whatever religion it is, and that's not something we need to get involved with. That's not respecting the other person. We're talking a lot about respect. Okay? But if it's done with an open heart, and it's, so that more compassion can be there, concern for the other person that's really hurting, then this is actually, this helps the healing process. The other person feels better, they can feel it, we feel better. So it's one of those win-win situations, which is marvelous. But it's not limited to, we also had this discussion earlier, it's not limited to religion. People that are kind of have a humanistic attitude or approach to life, maybe some altruism, not based on religion, same thing happens. Open heart, warmth, compassion, and I think do a better job, all else equal, do a better job as a physician, as a healer. So these are, I think, very, very important qualities, regardless of our religious background or not. Now, did you have a question also about Medicine Buddha itself, or were you asking about people that are practicing Medicine Buddha? Practicing Medicine Buddha. I don't know so much about that because, the people I know that practice Medicine Buddha are not physicians, primarily. But I'll have to keep my eyes and ears open and start to ask some of these students that I've been teaching year in and year out in some of these places and try to get some feedback. And so maybe next time we meet, I'll have something more to report to you. Thank you very much. Please.
I just want to ask, I'm a Christian myself, and all my friends are Christians. I just want to ask how do you as a Buddhist view death as a, since it's a Buddhist society, I just want to see a way to think about it.
Sure, sure. Lovely, thank you very much. I gave a talk, was it Gulu? No, in Lama Island a couple nights ago about death and dying, and there we talked about the Buddhist understanding of death, and I think that's your question. And it's a process. Okay? It involves 8 stages, so it doesn't happen immediately. Okay? In fact, it can take up to 72 hours, 3 days, for this death process to complete. And these 8 stages are basically, the first 4 are the physical elements, our body basically, starting to weaken. And then the latter 4 stages are more the mind, the consciousness, the feelings, starting to weaken and kind of reabsorb from gross to subtle. Now let me explain that a little bit. Okay. But first, let me say this: I have to come back to self-confidence. I promised it. So the what was I going to say? Okay. So the first, so each of these 8 stages has an internal component. By internal component, I mean, it's like a vision. People see things, different visions, with corresponding to each of the 8 stages. And I'll tell you what they are in a moment. So firstly, the first 4 stages are the solidity element, the hard stuff in the body, the bones and the muscles and the tendons and the ligaments and the organs themselves, the tissue forms. Okay? All of that stuff starts to get weak. The essence of that gets weak. And it manifests as the person having trouble even picking up an arm. Sometimes it can't even open up an eyelid. Second is the liquidity element, okay, like the blood and the cerebral spinal fluid, lymph, urine, all the fluids, the synovial fluids, all the fluids in the body start to dry up. The person experiences great thirst, sometimes even sunken eyeballs, like moderate to severe dehydration. Thirdly is the so-called thermal element, or the heat element. starts to get weakened, so the person gets very cold. And even if you put a lot of blankets on them, it's difficult to warm them. And the fourth is kind of the kinetic energy, or movement. Fourth stage out of 8. And at that stage, what happens is the circulation of blood stops. Heart's no longer pumping. Circulation of air, respiration, breathing, stops. The muscles in the chest wall, the lungs, all that stuff, stops working. No more breathing. Okay. So that's where we all come in. We're called in. We check to see if there's a pulse. We check to see if there's breathing. In a rare, usually we don't do this, but in a rare situation, we hook up an EEG to see the electrical activity of the cortex, of the brain. And it's pretty much flat, silent. Okay? At that point, we all say, this person is clinically died. From a Buddhist understanding, the person has only gone through 4 of the 8 stages, hasn't actually died yet. Because the Buddhist understanding is that a very subtle mind and energy, which resides at the heart, so called heart chakra, will leave the body, usually through the crown. It might be the lower orifices, at the time of actual death, when these 8 stages are completed. So at this 4th stage, we're not there yet. We're not there yet. Then the next 4 stages of the mind becoming much more, we say, subtle. So it goes from conceptual thinking mind to a non-conceptual mind. Okay? What's a non-conceptual mind? Any of you ever had an intuition? Yeah, I see a few heads nodding. I'm sure all of you, many of you guys have had intuitions. You just know something, but you don't think about it. Yeah? It's a non-thinking mind. Afterwards, you remember it and you think about it.